Dr. Pam Jackson with Creekside Animal Hospital, and I was presented today with a case. This is Captain. As you can see, Captain has a very obvious head tilt. The head tilt is actually due to him having a little mass down in his right ear canal, what we refer to as a polyp. This actually will affect the nerves down in that area and causes constant infection. So what we're going to do today, we're going to get some blood work, make sure that there is no reason why he can't undergo anesthesia. We're going to get a CT scan of his head and see how invasive this polyp might possibly be. And then we'll kind of go from there. Okay, so let's talk about the anatomy of the ear canal. The ear canal is actually a very long structure. The lateral ear canal goes down and makes an almost 90-degree turn into the horizontal canal. And this little gray spot here represents the tympanic membrane or the eardrum. On the other side of the eardrum is a bony apparatus called the bulla. The bulla is often where a polyp will start to form, and it will grow through the tympanic membrane and up the ear canal. So although we're seeing it from up here, it actually originates all the way down here in the bone. And so just pulling the polyp out oftentimes will not cure the cat's problem because it has still got a small piece down here in the bulla. So if I compare that, this is actually a dog model. Cat is very similar. If I show you the cat skull, this is actually the skull of a cat. And you can tell from the side where that ear canal comes into. So it comes down and comes right into that hole right there. And if I flip them upside down, you can easily see the bulla or the bony portion of that skull that tends to be where that polyp originates. So let's say if our patient has a polyp that is originating down in the bulla. Okay, here we are taking Captain into the CT scanner, and we'll see what's going on in his skull. So this is the CT scan of our patient's head. Well, what we're looking at here is we're really wanting to look at that part of the bulla, or this part right down here at the base of the skull. So if I pull this down and we start to look at sections, basically CT scan is x-rays, they're slices. So I'm pulling at these slices and I can scroll down and I can start to see each individual slice. This over here is the left side of the head and this is the right side of the head. Remember, his head tilted to the right and the right is the problem side. So as I scroll down, you see this little air pocket right in here. This air pocket is the bulla, and in a cat is a two-chambered area. So I can see the air that goes through here. It connects to the external ear canal and goes all the way out. So that is a normal bulla and ear canal. The opposite side, the side that he has his head tilt on the right side, as you can tell right here, this bulla is full of a density. There is no air whatsoever in there. This is where the polyp is growing, possible infection. And not only is it full and no air, but you can see how thick the bone is at the base of the polyp, at the base of the bulla. So the bulla over here is very thin, the bulla over here is very thick, and that's from chronic inflammation. And as I continue to look out slices, here's the external ear canal, but you can see it does not connect to that bulla like it does on the opposite side. There is no connection there. This area right in here is filled with something soft tissue. In his case, most likely a polyp and probably some secondary infection. So what we're going to do is take him to surgery. We're going to remove that portion of the bulla and enter the second chamber as well. We'll get a culture of that area just to make sure we know what kind of bacteria could be growing in there. And then we'll send the polyp off for biopsy just to make sure it's not cancer. So we have our patient moved into the surgery. We're getting ready to proceed. I have beside here an actual skull of a cat, just so that you can see the anatomy as to where we're going. This cat is laying on its back, and so is the skull. This part right here is called the bulla, and that is the part that we want to try to open up. And this cat is going to be located right in this area here, so that's where we'll be making our decision. Get all the structures out of the way, being very careful of the anatomy. There's a lot of important vessels and a nerve in that area, so we'll very carefully dissect down to get to that. It is a two-chambered bulla in the cat, which we saw in the CT scan, so we'll go in there and get that done. Okay, surgery went very well. We were able to remove the bottom portion of the bulla and get the polyp out. We took a culture inside of that bulla just to make sure that we don't have any infection. We did go ahead and start on some antibiotics, and we'll change that accordingly based upon the culture. We also did a biopsy of this polyp. We want to make sure that it's not cancerous. Most of the time it is not, but every once in a while you get one that can be. So this is him post-op. He still has a little bit of a head tilt, which is what he presented with. That may or may not go away. Hopefully it will eventually. You can see his incision is very small, just underneath his neck there, where we actually went in. And he is recovering very well. Now, some potential complications you can see, especially immediately post-op, is facial nerve paralysis to where they can't blink. You may see Horner syndrome where one pupil is bigger than the other and a third eyelid is raised. He does not have either one of those two. Head tilt is also a common complication after surgery, which he presented with beforehand. So far he appears to be doing very well. We're going to be looking forward to hearing about the results of the culture and the biopsy, and then we'll follow up with the owner in about a week.